Hi, Dr. John Torres with NBC News. It's Friday. I'm going to give you your headlines for the week in this Facebook Live, talking about different things that have gone on this week and getting a little behind the headlines to give you an understanding of what those headlines means and hopefully some news that you can use going forward here to help you, your family, your loved ones, and your community get through this pandemic and hopefully end it sooner rather than later. And then go ahead and answer some questions you have. These are always great questions, so please send them our way so I can answer as many of those as possible. But first, let's start off with the news that's probably been the headline for the whole week, and that's President Trump's health and what's been going on with him. And I'll combine that with the second one I'm talking about, which are therapeutics, which are the drugs that he used and the drugs that we have out there right now that can be used against coronavirus, the treatments that we can use against coronavirus at this point, and what do we know about them. And then I'm going to talk at the end about some CDC holiday guidelines because we're getting close to the holidays and some important things to consider about both for overall holidays and especially for Halloween. Let me start first with President Trump's health. And as you know, he was diagnosed with COVID-19 over a week ago. He ended up in the hospital for a couple of days. Part of the reason he was in the hospital was because his oxygen saturation level dropped. At one point it was 94%, at one point it was 93%. It looked like he needed oxygen at least once, maybe twice during those events to try and get his oxygen level back up. This is important because this is a respiratory virus. It affects the lungs. And if people have oxygen saturation problems, in other words, if their oxygen level drops below 95%, on what we call room air without any supplemental oxygen, then that gets doctors concerned that there's something going on with their lungs and they could possibly be developing COVID-related pneumonia. When that happens, they put them in the severe category for symptoms. So we have three categories: mild, moderate, and severe. They say that puts them in the severe category. The complicating thing is he only had those two episodes. They said they were both less than an hour. I believe at one point they even said they might have been less than 10 minutes. And so does that constitute severe categories? Well, possibly, because I'll be talking about some other things that they did that looks like it might push them into the severe category. This is important because this helps tell us how his progress of the disease is going to be, and when we can start looking at getting him out of isolation, when he can start being out in public and around other people. So going back again, in the hospital for a couple of days, left Walter Reed, ended up going back to the White House and has been at the White House since. His doctor has put out numerous memos. He put out a memo last night, and in his memo he said that he has completed the course of therapy for COVID-19, that his vital signs were great. I don't want to go over all of them. He's responded extremely well. And he says Saturday will be, which is tomorrow, will be day 10 since Thursday's diagnosis. And based on the trajectory of advanced diagnostics, they fully anticipate the president's return to public engagements at that time. So Saturday being day 10. Well, looking at the CDC guidelines, what the CDC guidelines say is that once you're diagnosed with COVID-19, then you need to wait until after 10 days. So not on day 10, but after 10 days before you're no longer considered contagious and you can get out of isolation and go out and about. So if you look at, he was diagnosed on Thursday. So this is 10 days of isolation. So not 10 calendar days, but 10 24-hour periods of isolation. So we're looking at Friday, Saturday, Sunday, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. So we're looking at Sunday on day 10, which means that Monday would be the day that the CDC says, according to this guidelines, that's when you can leave isolation. Now, granted, the White House team are doing what they're calling advanced therapeutics. Well, I'm not exactly sure what that means, but I think that means PCR testing to look to see what his viral load possibly could be. And what they do in these PCR testing is they do something called a cycle threshold. So what they're doing is they're getting genetic material from the virus, they're running it through their testing machine. It cycles through because what it's doing is every cycle it's multiplying the amount of virus until it gets to a certain level where it says, okay, it's positive. You have COVID-19 and you could possibly be spreading it to others. The amount of cycle thresholds they go through, the more cycle thresholds they go through, the less virus you have because they have to keep multiplying it to get to that certain level. And then eventually they'll get to a level where they say laws of diminishing returns. It doesn't make any sense to keep doing it because more than likely you don't have coronavirus. And that's where a negative PCR test comes from. Well, and my guess is what they're doing is they're going through and watching these cycle thresholds drop down subsequent testing saying, okay, his virus load is going low enough to now we can consider him not contagious anymore. But again, remember the CDC guidelines are after 10 days, 10 days being Sunday, not Saturday, which means Monday would be, because that's after 10 days, would be the time that he can go about and not be considered contagious according to the CDC guidelines again. But that's actually for mild to moderate symptoms. For severe symptoms, they say up to 20 days. And so again, it gets a bit complicated with him, but also realize that he has a lot of behind the scenes healthcare going on that are looking at different things than what the CDC guidelines are saying. On top of that, well, again, we'll talk about the medications he received and what those mean as far as his symptoms and where he is now. But the president at this point, according to Dr. Connolly, his doctor is doing well. He's stable and seems to be doing okay. Now, I know there's been some incidences of him being on different programs, or at least a news program, where he was coughing a bit, and there was some concern about that. Does that mean he still has the disease? You have to remember that symptoms come on after the disease, and they stay after the disease goes away. And so you can get rid of COVID-19, but still have symptoms for weeks on end after that, and sometimes even months on end. Because again, it's a respiratory virus. If it affects the lungs, even though the virus is gone, you could still be recovering in your lungs, and you can still have coughing, maybe a little bit of shortness of breath. So those two don't necessarily go hand in hand, but certainly something to look at. On top of that, day 7 to 10, and that's what everybody, including his own doctor, have said, are the critical time periods. If you look at day 7 to 10, that is this Thursday, which was yesterday, to Sunday, are the critical days where this, all of a sudden, his symptoms could, as we say, turn south and could get much worse very quickly, requiring him to get back in the hospital. So far, that hasn't happened, but day 7 to 10 are the critical time window of days to look at to make sure coronavirus is okay and you've cleared the hurdle. Once you get through day 10, then as his doctor said, we can all breathe a sigh of relief, and more than likely he's going to be okay at that point. But those are critical time periods. So we'll keep an idea of what's going on. I know this plays a lot into what's going to go on next week, the debate, rallies, those types of things. Time will tell, and hopefully we get more information from the White House and his doctors about what these advanced diagnostic tests are, so we can all truly understand that, yes, he's no longer contagious and he can go out and about. But now switching to the medications he's received. If you saw a video the other day, he's received 3 different medications, which those medications, at least 2 of them are standard of care. The other one probably going to become standard of care because it just received its emergency use authorization. But the 2 big ones that are standard of care are remdesivir. That's an antiviral medication. That medication is aimed at directly affecting the virus and trying to get rid of the virus. And up until now, it's been shown to shorten the time period that you have symptoms and cut down on the severity of the symptoms at this point. Now, the other medication that he got was dexamethasone. That's a steroid. It's been around for decades. It's one of the first medicines I used when I stepped foot in the hospital back in the 90s. It's an old medicine. It's ubiquitous. It's very inexpensive, but it's also very strong medicine. Steroids, what they do, especially dexamethasone, is it tampons down the immune system. So it doesn't let the immune system act as much. And that's why for certain types of autoimmune issues or other types of symptoms or syndromes, that dexamethasone or other steroids can help, because oftentimes the immune system is attacking the body. That's the same thing it's used for here. It's used because what we do know is that COVID-19 can rev up the immune system to the point where later in the course of COVID-19, it can start attacking the body. If you've heard the word cytokine storm, that's exactly what that is. That's the immune system going into overdrive, attacking the body, attacking organs, and people unfortunately die from that. And COVID-19 is notorious for causing that cytokine storm. That's why we have found out that dexamethasone is one of the medicines that actually can cut down on the death rate if given appropriately. And by given appropriately, it's reserved, and this is per NIH guidelines, the National Institute of Health guidelines, it should be given, it's recommended to be given to patients who are either on a ventilator or on supplemental oxygen in the hospital. It's recommended against giving it to patients who are not on a ventilator and not on supplemental oxygen. Well, President Trump got it, but other experts are saying, well, oftentimes we'll give it to patients, even if they're not on a ventilator or a supplemental oxygen, if they have severe symptoms. And so that's kind of the third criteria for this. Severe symptoms, again, remember, if you're having those low oxygen levels, usually on a continuous basis, they put you in a severe category. He didn't have those, but yet it looks like he might be being treated for severe symptoms. The main reason you don't want to do it for mild to moderate symptoms is because at that point your immune system is still fighting coronavirus. If you give them a medication that tampons down the immune system, it can't fight the coronavirus, and so that can make things worse. And so again, it's usually reserved for that. The third medicine that he got, and he actually put a video out on this, is a medicine he called Regeneron, but it's a medicine by a company called Regeneron, and it's a monoclonal antibody cocktail. What they've done is they've taken 2 antibodies, and they've pushed them. They basically duplicated them in the lab. So they've gone to people who have survived coronavirus, survived COVID-19. After they've recovered, usually a couple weeks later, their body starts developing these types of antibodies. They end up getting the blood from them, the plasma. They filter out the antibodies. That's convalescent plasma at that point. But they'll take some of those antibodies in the lab, and they've done this. This company Regeneron and another company, Eli Lilly, have done this, where they will get these antibodies and they'll duplicate them in the lab. In Regeneron's case, the one the president got, they'll put two of them together into this cocktail and they'll give it to the patient. They're doing clinical trials. There's been thousands of people in clinical trials getting it. There's been a handful of people getting it from compassionate use basis, which is what the president got as well. What we know is, if given early on, it actually helps jumpstart the immune system. So before the immune system can get activated, because it's trying to figure out what it's fighting, because it's never seen coronavirus before, this type of coronavirus. And so it's working around trying to figure out what it needs to do. If they give them this antibody treatment, the antibodies are specifically targeted at coronavirus, because remember, it came from patients who survived COVID-19. So they're specifically targeting coronavirus so they can help fight it off as the immune system starts developing that knowledge about the virus and can start fighting it. And so it's a stopgap measure before the immune system kicks in. And some people are calling it kind of a bridge between therapeutics and vaccines. It's kind of a halfway in between to help us out until we do get that vaccine. So that one, it just got submitted for emergency use authorization. They're still looking at it. But if it is emergency use authorized, which I don't see any reason why it wouldn't be, it's going to start being used across the country. And it looks like it could potentially help a lot of people both cut down on their symptoms of coronavirus and I think as well save lives, which is the important part here. So that's what's going on with the president and the therapeutics he's used. Now, the other thing I want to talk about is, and this wasn't a headline, but it's what's coming out. And the CDC has put out holiday guidelines. And I want to split this in a couple different ones, Halloween and all the other holidays. For Halloween, what they said is, as you know, both holidays and Halloween are not going to be typical holidays. It's not going to be a typical Halloween because we have a pandemic. So things are going to be different. So what the CDC did, and you can go to you can Google CDC Halloween guidelines, they've actually broken it into 3 different groups, and I think they did a good thing. They have low risk, moderate risk, and high risk. And some of those categories, what they put in there, are in low risk. Essentially, it's you not being around anybody else, and that makes it very low risk. So things are either done in your house or virtually. In your house, they're talking about having pumpkin carving contests or decorating contests or making special meals that day or special desserts. The other thing they said is, how about a virtual costume party or a costume contest where you get with, kids get with friends that they have, they're with them virtually anyway. Let's do a costume contest. That way people aren't around each other. That's a low risk. Moderate risk, what they're talking about, are a couple different things. And this is being around other people, but making sure you social distance. One of them is a costume parade, but where everybody stays 6 feet apart, everybody's wearing masks, you're social distancing, you're doing all the things you know you need to do to stay safe. And that is a moderate risk of contracting coronavirus. The other thing they said on top of that is what they call one-way trick-or-treating. One-way trick-or-treating means that you go by with your kids and the family, the house members have actually put individually packaged treats either in the driveway or in their yard, and so that way kids could go out there, pick up a treat and come back to you or come back to the car and go on to the next house. It's one way, meaning the kids don't interact with anybody. They don't say trick-or-treat or interact with anybody. Essentially, they get what they're mostly there for, which is the candy or the goods. And so that's one-way trick-or-treating. That's in the moderate category. The high category, they put parties, haunted houses, where you're out with other people where they're not being as safe as they could be, and certainly trick-or-treating the old-fashioned way, which is going door to door, knocking on the door, ringing the doorbell, trick-or-treat, and they hand you stuff. They say that is a high-risk category, not to do that. So again, look at the low-risk, high-risk, moderate. Look at the low-risk, moderate-risk, high-risk. Doesn't mean you can't have fun. Doesn't mean your kids can't have fun. Just being a little creative. So Google CDC Halloween guidelines, and you'll see all the different categories there. The other one they've put in there is what to do over the holiday season, because a lot of people are going to travel. And on one hand, they're saying you probably shouldn't travel anyway because we're in the middle of a pandemic, but they also realize that people are going to do that kind of thing. And so here's ways to do it. They broke it up into 7 different tips. One of them are, look for community levels of COVID-19. If you're going to a hotspot, don't do that. Look at the location of the gathering. Is it outdoors rather than indoors? And I know we're coming into cold months, but it's possible to have an outdoor gathering where people bundle up and they can still have fun. Think about the old days when they used to do this before they had heaters, before they had all the conveniences we have now. How long is that gathering going to be? Because the things we know, the more people you're around, the closer you are to those people, and the longer you're around those people, the more likely you are to spread or get coronavirus from them. So look at that. The number of people. Is there a sufficiently small enough number of people that everybody can social distance and they're going to be doing okay? And this is an important one, a couple of ones here. Where are the other attendees traveling from? Are they going from spots that are hot spots to this area? If so, you might want to think twice about it, or you might want to bring up to the attention of the hosts, hey, should we be inviting people from areas that are hot spots? Certainly a consideration. And then the behaviors of people attending the gathering. And this is an important one, I think, because essentially what they're saying here is that people attending the gathering, what have they done before the gathering? In other words, have they been keeping safe over the couple weeks before the gathering? That way you have a good idea that they're going to be safe enough to be around at the gathering. And on top of that, what's their behavior going to be at the gathering? Are they people who are adamant about not wearing masks? Are they people who are adamant about hugging and shaking hands and kissing cheeks, that type of thing? If so, again, you might want to think twice about it. So the bottom line here is holiday season, we all want to be with family, we all want to be with friends, we all want to be with loved ones, and we want to enjoy the holidays. Kids really want to enjoy trick-or-treating on Halloween, but we're in the midst of a pandemic. We didn't have this last holiday, so this is going to be new for all of us. So you have to be creative. You have to be patient, you have to be understanding, and you have to realize that it's going to be different this year. There are ways to do that. There are ways to have fun. There are ways to interact with family, but you want to do it safely to make sure you and everybody else is safe. So again, I'll get to questions here in a second, but let me go over the headlines again. President Trump's health, he was in the hospital. Couple days, has gotten out of the hospital, taken some medication, some other treatments, and seems to be doing better, but he's still in that time window of where things could go all of a sudden, the symptoms could get worse, just needs to be kept a very close eye on, but according to his doctor, he's doing better, probably because of the medications he got. Those medications, remdesivir, an antiviral, dexamethasone, a steroid that's usually reserved for severe cases or people that are ventilated or on supplemental oxygen. And then the monoclonal antibody treatment that he got from the company Regeneron that can help jumpstart the immune system and looks very promising and is now seeking emergency use authorization. On top of that, holiday gatherings, holiday travel, Halloween. Again, go to the CDC. You can Google CDC Halloween guidelines to get the Halloween guidelines, and you can Google CDC holiday guidelines, and they'll talk to you about that as well. And again, there's those 7 things to look at to make sure that you're going to be safe and other people are going to be safe at the gatherings and help you make an informed decision. The other reason I give this to people, and I've emailed it to a lot of people, is because if you have those CDC guidelines for the holiday and you're getting pressure from somebody in a different part of the country to come out here so you can celebrate with us, you can send them this too and say, hey, let's go over this together and see if it's something that we really want to do. And hopefully that gives you a little bit more information and both of you a little bit of understanding of whether it should be done or not. But now let me see if you have any questions.
Do we know if President Trump has tested negative yet for COVID?
President Trump has tested negative for COVID, and I'm trying to find here. I'm trying to look in the actual indications we got from Dr. Connolly. Yeah, what they're saying, and here's his quote: based on the trajectory of the advanced diagnostic the team has been conducting, that he fully thinks he can go out in public. And so misspoke there for a second. Not exactly sure if he's tested negative, but what they're saying is that his testing is looking good at this point. Not exactly sure what that means, but hopefully before they start releasing him in public, we get a better understanding of what that testing means and whether it's something that is sufficiently safe enough for him to be out in public. One caveat, just because you test negative, depending on what test it is, may or may not be as accurate, and so it might not give you as good an understanding as what they're doing.
I understand that we will have a vaccine available for everyone by January. Is that true?
So is it true we'll have a vaccine for everyone by January? Probably not. And here's the reason why. The FDA just released some guidelines that's going to extend the time period it takes to get the vaccines emergency use authorized. And what they want the companies to do is look a little harder at side effects for longer periods of time. So because of that, probably January time frame, maybe the end of the year, maybe February, but somewhere in there, I think you're going to see companies start looking for emergency use authorizations. Right now, there are 5 companies that are in the lead of this race for the vaccine. I think you're going to see 1, 2, maybe 3 of those companies looking early on, maybe the end of the year, maybe January, February, for this emergency use authorization. So let's play the game out. Let's say they get emergency use authorization. Well, these companies have also ramped up production, which is unprecedented. This has never happened with vaccines, because typically what happens is the vaccines get approved, not this EUA, but they get approved after years and years of extensive research and years of clinical trial. Then they get approved. Once they're approved, then they start production. That takes 6 months to a year. Then they start getting it out. But that's been in normal times, not in pandemic times. So what they've done here, and this is with the backing of the government's money, which is taxpayers' money, is they basically have taken the unprecedented step of starting production now, even though they have not gotten that emergency use authorization and they have not gotten an approval. The hope being that they do get that authorization and they've ramped up production and produced enough of the vaccine that they can start distributing it at that point. The reason that's important is because the last thing we want is for them to get the vaccine authorized or approved in January, and then we don't start getting the vaccine until summertime. They want to get it out immediately. But by the same token, remember, there are 330 million people here in the U.S. There are 7 billion people in the world. Everybody's going to be vying for that vaccine. Regardless, here in the U.S., we are not going to get enough numbers of the vials, the vaccines themselves, to vaccinate all 330 people all at the same time. So there's going to be phases. And the National Academy of Medicine, National Academy of Sciences came out with their own phase recommendations. Phase 1 are going to be frontline healthcare workers. These are people in the hospital face-to-face with COVID patients, and they need that protection. Also, patients that are high risk, like nursing home patients. And then phase 2 is going to bring down to like teachers, those with pre-existing medical conditions that could make them more vulnerable. And then phase 3 and 4 are going to be more general population. And so you can see phase 1 is probably going to take place over the first month or so when we get the vaccine. So we're already talking, if we get it approved in January, February timeframe. Then phase 2 will probably be March timeframe. So it'll probably be April, May timeframe before the general public gets the vaccine. And I know there's a lot of vaccine hesitancy out there, but right now, the biggest thing is making sure that transparency is available for the manufacturers of the vaccine, their testing procedures, their clinical trials, and what they're pushing forward for the emergency use authorization. They're making great efforts now to try and get that transparency. We'll see how well those efforts pay off and whether we get it or not. And you'll hear from a lot of people, including myself, do we think it's transparent? Would we get it ourselves? Do we feel confident in the safety of the vaccine?
There have been over 200,000 deaths. Are these deaths only associated with COVID-19, or is it an actual cause of death? So,
and I've gotten this question a bit over the last couple of weeks, or last week in particular, because there's been some information out there about the deaths from COVID-19 and how they're calculated. And some people saying, it's fake news, it's a lie, because 94% of these deaths didn't come from COVID-19. They came from something else. Only 6% of these deaths were from COVID-19. Well, here's what happens, and here's the fact. Oftentimes, most people, and I'll equate this to the flu, most people don't die from the flu. It's very rare that you actually die from the flu itself. You typically die from something the flu does to you. And a lot of times people will die from flu-related pneumonia, or they'll die from flu-related sepsis, which is a blood infection you get because your body doesn't know how to handle it. Or you'll die from flu-related cytokine storm we were talking about, the immune system issue. Same thing happens with coronavirus. People can die from coronavirus, but they can also die from complications of coronavirus. And let me walk you through a scenario here. Let's say that you have a heart condition and you survived a heart attack, and they've put cardiac stents in there, and those stents have worked to a certain extent, but they're not working as well as they used to. But you're doing fine, and then you get COVID-19. That's put huge stresses on your body, and then you subsequently have another heart attack and you die from that heart attack. Did you die from a heart attack, or did you die from a heart attack because you had gotten COVID-19? And so that's where the confusion comes in. Without COVID-19, probably would not have had the heart attack. And the other thing I equate it to people is it's similar to people who are in massive traumas. Let's say they're in an accident and they end up in a car accident. They bleed a lot. We give them blood products to resuscitate them. They're doing fine, but the next day they go into a shock and they die from that shock. They die from either maybe an infection they got from the actual accident itself. But they didn't die from the trauma of the accident. Did they die from the accident, or did they die from somewhere else? Well, they died, or from something else. Well, they died from something else as a result of the accident. So same thing there. This is people dying from COVID-19 related illnesses. that they most likely would not have gotten if they had not gotten COVID-19. So they're put into that COVID-19 category as well. That's one thing. Number two, especially early on in the disease or the pandemic, there was a lot of confusion as to how to go ahead and code these. So when you come to a hospital, when you go through and we fill out your chart, we put a code down there. Those codes are for certain conditions. COVID-19 was new, so those codes were very confusing at the beginning. On top of that, when somebody dies, the coroner or the physician or the medical examiner, they put down the cause of death. Oftentimes that cause of death will be a one line, what caused their death? Well, they died from a heart attack, or they died from multi-organ failure. But what they don't say is they died from multi-organ failure as a result of cytokine storm, as a result of COVID-19. And so you can see where I'm going here, that COVID-19 can cause issues that can cause somebody to die, but you can't say that it was not COVID-19 related. So again, of those 200,000, you've been hearing somewhere that only 6% are COVID-19. The other 94 were something else, some other condition they had. And it's true, they probably had pre-existing conditions, but their death was brought on by the fact that they got COVID-19. And so hopefully that helps out. But again, thank you for your questions. They've been wonderful. Going over the topics real quick, President Trump, again, he's at the White House. He got COVID-19, was in a hospital for a couple of days, got some multiple medical treatments, and is at the White House. He still has a few days to go at the White House, so we'll see what happens over the next couple of days. But he's in that critical window right now to see if his symptoms keep improving. And if they do, hopefully by Monday or Tuesday, we can say, okay, looks like he's out of the woods at that point. The therapeutics he got are therapeutics that pretty soon should be available for everybody. Remdesivir, which is already available, an antiviral. Dexamethasone, which is already available. It's a steroid. And then the monoclonal antibodies, which are seeking emergency use authorization right now, which look very promising. And hopefully those are available very soon. And then on top of that, holiday travel, Halloween guidelines. If you go to CDC Halloween guidelines, if you go to CDC holiday travel guidelines, you'll find out information about what to do to make sure that you stay safe. But overall, like I say, hope you have a fantastic weekend. I want to make sure you, your family, your loved ones, and your community are as safe as possible. And hopefully you're doing the things that we all need to do to get through this pandemic as quickly as possible. And my biggest hope is that you stay as happy and as healthy as you can. Thanks.